Okay, so the upper arms. You can do, actually you can put threads on any part of the body, approximately. And the upper arms, to just tighten it up a bit if you have some sagging skin here. This hurts a bit more for the patient. It's a very sensitive area, but you've done your face, so I wouldn't recommend actually doing these kind of amount of threads on the same patient during the same day. It's actually too much, but you can handle this today. Okay. Just to be on the safe part. Are you comfortable like this?
I'm fine.
Okay.
You?
Oh, thanks. And then I will need the pen. Hmm? And upper arms, you can go on and on and on, as well as the abdomen. I'm going to show you just the basics here. Thank you. And here you have to keep a zigzag pattern. I usually draw an X, and you have to be like 5 centimeters from the axilla and 5 centimeters from the elbow. So like a zigzag pattern. Like this. And on your papers, you only see this. It's just to keep it more simple, otherwise it's going to be too complicated. But I will show you later also that you can you put a lot of threads here, medially, and then more laterally, so that they cross-link each other like this. I will show you that. And I will basically use the 27 here. If it hurts, just let me know. So I start from here, same technique. And for the upper arms, you need a lot of threads here too. It doesn't hurt?
No, it's fine.
And you have to follow the angle of the arm. So sometimes you have to bend the thread and the needle a bit. And you can always keep one finger on top just to feel it where you are. So in this kind of manner, you do it, and then you go like cross each other. Like you put more and more threads like this. Usually it's better to remove the needles after you've done a couple of them. I'm just keeping them here right now just so you can see. So in this kind of way, a manner, you can go on for like double the threads. So this will stretch the part of the upper arm, the skin here. Is it okay?
Yeah.
All right. So I'm going to remove these.
Okay.
Alcohol. Also here, you can use the 25 just to put it like going straight under, just to stabilize it. Do you mind if I do it? Okay. Orange, just one. Thank you. Sorry.
Yeah.
So, and if you have a lot of fat or anything, remember you can always go a deeper just to create the lipolysis. It won't give that much effect, but a bit it does, especially in the chin area. Thank you. How many did I use?
25.
About 25, okay. Yeah, I use 25 here. I usually recommend you can go up to 50. So, next star. How do you feel here?
Fine.
Fine? Okay.
The last one, the one you use the 25G to stabilize, why did you choose to insert it the other direction, from the elbow towards?
Actually, that doesn't matter. No, it doesn't matter which way you do it. But I used to go straight down because it's easier from this angle to put, because it's so long from this way. If you feel comfortable doing this way, sure. And I didn't use the 25 here as I did with the 27 because it's more difficult to bend because it's kind of half round shape over here. Sorry?
The last one was the 25.
Yeah, that was 25 and 90 millimeters. You have different lengths on those too. Usually I feel comfortable using not that long because the other ones are easier to bend and use. But I really like the 25s, especially on this area here. But you could go for the 60. Okay. The pen, thank you. You're always one step before me. So we're gonna do the same thing here. It's okay. So do you feel comfortable doing this now on your patients. And what's good about these V-soft lift threads, it's actually if you feel that you're not in the right position, you can always take it back. There's some more here. Okay, so the second arm, same thing as the right one. And as I said, you can put a lot of them over here. The more threads you put, the better the result. And now the other one, okay? Mm-hmm. And the 25. that was the upper arm lift. And a couple of months, you will see a better result. But I could put a lot more here.
Okay.
Okay?
Okay.
But you've had your face and everything, so I recommend not.